Okay, good evening, everyone. Thank you very much indeed for logging on. We're doing these talks every month. Before I forget, our next one is on Monday, the 28th of February, when one of our physiotherapists, Davina, will be doing a talk about tendon injuries. That's things like Achilles tendon, rotator cuff, shoulder injuries, etc. So tonight we're going to talk about beating back pain. I basically put this together because I find myself talking with patients every day about everything that's in this presentation, essentially. So as a result of lockdown and the pandemic, we've seen a big increase, as have most clinics, in back and neck injuries. When I say beating back pain, I'm also referring to neck pain as well. So I'll be talking a lot about that. So just a little outline. I'm going to talk about the incidence of back pain, the causes, posture and mechanics, how the spine works, and then investigation of back pain, and then treatment and rehabilitation, and then some tips on prevention and looking after your back, which is obviously a very big part of this talk. I also want to finish off with my own story. I worked in Australia and New Zealand in the 80s, and I had a very bad accident in Sydney, Australia, which involved injuring my own back. So I do know what pain is like, and I'd like to think that I follow all the things that I'm going to talk to you about tonight, which is why I'm still sort of functioning and able to work and do sports, and I do quite a lot of sports as well. So we'll move on to the next slide. Oh, hang on a second. So I'm based in two places. We've got my own clinic in the Putney Clinic of Physical Therapy, which is based in one of London's largest GP centres. There's 21 GPs. It's an NHS building, and we have the second floor. We've got 5 treatment rooms and a gym, and a whole team of people. We've got osteopaths, physiotherapists, acupuncture, podiatrist, psychotherapist, a surgeon. We've got a nutritionist working offline. We've got Pilates teachers. We've got a whole range of people. And essentially the whole idea is to sort of work as a multidisciplinary team, sort of one-stop shop, really. The other place I work at is 2 Lower Sloane Street, which is a private GP and surgeon centre. So I work very closely with lots of doctors and surgeons, and I get sent a lot of spinal problems by consultants, because as you'll see, 95% of back problems get treated by physical therapists. It's only 5% that really end up needing specialist care from surgeons. So that's a big part of what we do. Apart from the human cost of back pain is the second biggest cause of time off work, and it costs a staggering amount of money. As you'll see from these figures, it costs about £1.3 million to the NHS every single day, and about £13 million in government benefits, and a £37 million bill each day for the UK economy. So it's a colossal amount of money for the economy, and it causes a lot of pain and suffering for people as well. So there's a financial as well as a human cost, and the burden on the NHS is enormous. So that's part of the reason why I'm trying to promote the sort of self-help and prevention angle, which hopefully will help to reduce some of those figures. This is a graph. This is the World Health Organization. It's quite a confusing x-axis, the dailies. This represents the amount of hours of suffering and disability. I'm not quite sure of the scale because it says 7 million there. Anyway, the point is that if you look at the figures here, this is 1990. You'll see that most back pain tends to occur in the age group from 30 to 60 years of age. And the reason is for that is that most back pain sort of builds up and is accumulative. So you'll see this peak around the age of 30. So you can get away with treating your back badly and slumping and having bad posture in your teens. But by the time you get to your kind of 30s, things start to catch up with you. So you get this peak at between 30 and 60. It slows down after that, mostly because people slow down and become a little bit less active. So this is the group 30 to 60, which tends to have the highest amount of back pain. And if you see the figures for 2015, you'll obviously see that things are increasing enormously. And this is a global burden of back pain. So all around the world where you're seeing more sedentary activity, where people are moving from more sort of agricultural kind of economies to industrialized and office-based, you're seeing a rise in back pain. Kenya, for example, where I spent part of my childhood, traditionally the local Kenyans didn't really suffer back pain, particularly because they were more physical in their work. But now that they're becoming more office-based, like the rest of us, you're seeing this sort of increase in back pain. And as I say, that's a sort of global problem. So the causes of back pain, there's a multitude of causes. If I start on the top right, gender, women outnumber men just slightly. Women tend to get back pain slightly more than men, probably the result of things like pregnancies and childbirth, also linked to the menstrual cycle and the relative softening of the ligaments premenstrually with estrogen and progesterone levels. So it's not much, and it's pretty much just slightly more women than men. If you look at things like body mass index, obviously the more weight you carry, the more mechanical stress there is on the back. So the BMI is a factor as well. And if you look at posture, I always say to patients that good posture is good mechanics. So and we'll talk more about posture as the talk progresses, but working on if you think of the human body as just a system of levers, if you've got good levers, good posture, then you're going to get less problems. Fitness and spine strength, well, there's a lot of research evidence that shows that if you have a good muscle tone and good level of fitness, then you're going to get less likely to get back pain. Smoking is a big factor. Smoking interferes with the blood supply to the spine itself. So if you're a smoker, you've got a higher incidence of back pain because you're going to interfere with the supply of oxygen and nutrients to the spine, and that leads to degenerative changes and more likelihood of pathology. Occupation, believe it or not, actually back pain is almost higher in people who are just sitting and working in offices. And you'd think actually people who are digging up the roads and doing more manual work would be suffering back pain. They do get back pain, but if you think about it, because they're active every day and they've probably been doing the job for many years, they tend to have a relative speaking, a lower incidence of back pain than someone who's sedentary and office bound. Injury, obviously there's what you would call traumatic injury if you have falls or car accidents, and then there's a more slower microtrauma, which I'll come on to a little bit further so in the talk. So there's different types of injury mechanism. Stress is a really big factor. When you're in a kind of flight mode, when your brain and body is under stress, your brain is going to release stress hormones like cortisol. And we know that cortisol has an impact on not only raising muscle tension because it's preparing us for flight or fight, but if stress is of long duration, if it's not for short bursts, then it starts to suppress repair systems. So you start to get compromise on your ability to repair damaged tissue. And you also reduce your effectiveness of your immune system, so you're more likely to get ill. So stress is a really big factor. It also is something that's definitely increased as the nation's gone through pandemic, just locally and globally. And I think the sort of anxiety and the uncertainty of what we've been going through as a nation has definitely contributed to particularly upper back and neck pain. Disease, well, there are things like sort of infections like osteomyelitis and infections of the spine. Osteoporosis, which is not technically a disease, but that's demineralization of bone as you get older. That can be a cause of back pain. And then you've got genetics. You've got the autoimmune conditions, which are familiarly linked, so it runs in families. You've got rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, all these different autoimmune conditions and predisposition to getting back pain. And then, as I said before, age 30 to 60 tends to be the sort of peak of back pain, but obviously it can occur at any age. So you've got the kind of high energy form of back pain from things like whiplash trauma, falls, accidents. This obviously results in significant tissue damage, and accounts for only about 30% of most back pain. Most back pain is sort of accumulative. So the low energy back pain, which is microtrauma, you'll probably see from this diagram on the right that that's something that is a very familiar sight, where people are sitting in that kind of hunched slump position. So there's mechanical stress on the low back, the mid back, and the neck. And that's what you call submaximal microtrauma. So that's day in, day out, a slow burn, a buildup of mechanical stress. And if you stay in one position for a long period of time, you start resting on the ligaments and putting more strain on the joints and on the spine itself. This is you know, sort of typical stuff you see if I go on the tube. I'm always amazed at how many people I see sitting like this, neck down in that sort of sustained position, and people stay in that position for a long time and don't move. The modern day thinking about posture is not that we should be rigid and upright. It's actually about movement. It's about changing position regularly. So if you're going to be in this position, you see in this diagram here showing the skeleton, then you know, be in that position for short periods of time, because if you stay in that position, you're putting a lot of stress through the neck, through the mid back and the low back. And as clinicians, we see a lot of people with 3 levels of pain, where they've got low back pain, neck pain, and mid back pain. So if we look at the next diagram, you'll see that if you're in a neutral position with the spine in the kind of S shape, your head raise anywhere between 3 to 5 kilograms. But if you increase the angle of inclination of the neck by 15 degrees, you're suddenly carrying 12 kilograms of weight. And if you go up to the extreme, you'll see that you know, the weight goes up significantly. So when you're in this position, you've got 22 kilograms of weight, putting a lot of stress through the soft tissues, through the ligaments, through the muscles. And if you're not moving and you're holding that position, it's a bit like me getting my finger. And if I hold that finger for 20 minutes, when I let go, you know, it's painful, it's sore. It's no different for the ligaments and joints in your neck. So if you're staying in these fixed positions, you're increasing significant loading through the neck. So it's all about trying to move regularly. Again, this is effective posture on the lumbar spine's pressure. So we're now looking in the low back. And when you're lying down, there's a certain amount of pressure going through the back, but it's 25% through the tissues and so forth, and through the discs. And when you're standing, it's 100%. But as soon as you start sitting, especially if you're sitting in a slump position, you can go up to 275% pressure. So if you're staying in fixed postures, as I said before, you're increasing the chances that you're going to get back pain. So you know, it's about movement, it's about changing position regularly, and this kind of illustrates you know, how posture interferes with sort of mechanics. Now, the human spine is a very complex structure. It's probably secondary to the brain. It's probably the most complex structure in the human body. I'm going to try and keep it simple, but essentially, if you look at the spine from the side, you'll see that it's got the kind of S-shaped curve, and this gives it a kind of springiness. I was trying to load before the talk a video that I found of a crowd walking, and next time you're following a crowd, you'll see everyone's heads are bobbing up and down. And if you follow someone who's got a ponytail, male or female, you'll notice that the ponytail swishes from side to side. That's because the spine is sort of basically has a sort of springy structure. If it was straight, you know, for example, if you took a stick and you pressed on it and it was straight, you get no viscoelastic properties. But because it has an S shape, it's able to absorb pressure. Now it's divided into, you've got coccyx at the bottom, the sacrum, the lumbar spine, the thoracic, and the cervical. There's 5 vertebrae in the low back, in the lumbar spine, 12 in the thoracic, and 7 in the cervical. This is just to illustrate where the spinal cord sits. And if you look at the diagram on to the right of it, this is the disc at the front here, and these are the nerve roots coming out through between the disc and the joint. Now the discs are like shock absorbers essentially, and that's where a lot of movement takes place. They have a jelly substance inside them, and they have rings of cartilage, and they're actually very strong structures. If you put a healthy disc in a laboratory and tried to crush it, it would take about 1,400 to 1,500 pounds per square inch pressure. So you're not going to go from a healthy disc to a bulging disc. That is something that sort of builds up over time. And if you look at the joint at the back here, sorry, where's my mouse? That's it. I'll show you this in more detail in a short while, but you've got the joints here and the discs at the front. This is the front of the spine and this is the back. These are the spinous processes. This is what you can feel when you touch the skin, and the joints lie fairly deep. As I say, when you look at how the spine works, it works as a sort of chain system. So if you do get low back pain, you very often have pain higher up in what you call the kinetic chain. So because it works like a chain, if one area is stiff and restricted, it's going to affect the other areas. And a healthy spine would be one where all the movement at the joint level is symmetrical. So all the joints are moving in harmony, as it were. And one of the effects of prolonged sitting is that you, over time, develop areas of stiffness, particularly in the low back, mid back, and in the middle of the neck, from being that kind of slump posture. And once you start getting areas of stiffness, then you're moving less efficiently, you're more predisposed to getting other injuries, particularly things like disc problems. There are about 650 muscles in the body. Some are paired, like the biceps, you'll have one on the left and the one on the right. And then if you look at these, the trunk makes up the bulk of the muscle mass, and good muscle tone helps to dampen force going through the spine. Muscles don't just contract and move you around, they absorb day-to-day force and pressure. So the better your muscle tone is, the less stress there is on the joints in your spine and on the discs. And this white stuff is called fascia. Fascia is a sort of connective tissue. In the old days, we used to think this was sort of some sort of wrapping that had no real particular use. And I spent 2 years doing human dissection at St. Thomas's, and the supervising professor used to basically cut that off and put it to one side, and we didn't really talk about it. But all the new research in the last sort of 20 years has shown that fascia actually has a fundamental role in absorbing force and works in tandem with the muscles. So we now refer to it as kind of myofascial, so meaning muscles and fascia. And that's a very important part of preventing back pain, is making sure all this works properly. So when you talk about core, a lot of people are quite obsessed with just having a six-pack and abdominals. Core is actually really about the spinal muscles. The gluteal muscles, pound for pound, are very important stabilizers of the spine. So it's hard to know where core begins and ends, really, but it's essentially the whole pelvis and the whole trunk. But we'll come on to that in a short while. So in an ideal world, if you looked at what you would call a neutral spinal position or a neutral posture, if you drew a line down the middle, you would weight bear through the middle of the joints, through the middle of the knee, middle of the hip, and then through the middle of the spine. One of the things I was doing when I worked at Liverpool Football Club for a season was we were looking at trying to optimize the player performance by making sure all these joints move symmetrically, particularly in the spine, because that's where a lot of the force of movement comes from. I was basically checking the players and then reporting what I found, and then treating the individuals for trying and optimize their kind of movement. So my master's degree, as I said, was in sports medicine, and my specialist interest was biomechanics, how the body moves, and that's what really a very big part of how I think about treating people, is trying to optimize their movement. And if you're talking about it in sport, then you know, if you don't move properly, then you basically don't generate enough force. You start to develop areas of stiffness, which means you're leaking energy, and you're not moving efficiently, and therefore you're not only is your performance compromised, but you're also more predisposed to injury. So in an ideal world, and very few people actually stand like this anymore, I think the only time you see this kind of posture really is in children when between the age of 2 and 5. And if you look at a child age 2, they stand in this beautifully balanced posture. And that's because they haven't been subjected to prolonged sitting. Once they start going to nursery school, primary school, secondary school, and then on to either university or office life, all that sort of changes. So that kind of nice neutral posture is very much in the 2 to 5 age group. And as I say, in that neutral posture, you're basically putting force through the middle of the joints, and you're therefore less likely to start developing abnormal wear and tear patterns. So if I look at, you know, what can go wrong, so the two main causes of back pain are either inflammation in these joints. This is the front of the spine. This is the disc. This is what you feel through the skin, the spinous process. And these are the spinal joints. Now, there are a whole chain of them, but they're small. In the lumbar spine, they're about the size of a thumbnail. By the time you get to the top of the neck, they're about the size of a small fingernail. Now, they're fluid-filled cartilage joints. So if you strain them, it's a bit like twisting your knee or ankle, it will swell up. Now, because we can't see our spine and because these lie quite deep beneath the skin, we don't see any physical evidence of any injury. All we feel is the pain. And the problem, because the spine is the main frame of the body, there are millions, well, not millions, but there are hundreds of nerve endings in every one of these joints. There are more nerve endings in these small spinal joints than there are, for example, in a knee. And that's because the brain needs a lot of information about the position of the body in space. And that's great when it's all working well. But if you twist and injure one of these joints, anyone who's suffered back pain, which is joint related, would know how painful it is. So that's what happens. These joints swell up and get inflamed. That causes pain. Now, after the inflammation has gone down, what can happen is these joints can develop what's called facet joint adhesions. They can effectively glue up and they stiffen up. And that's one of the parts of where we come onto the treatment part. One of the jobs of the physical therapist is to try and reduce the stiffness in joints and get things moving properly. And it may mean working on other parts of the spine just to make sure that everything is moving in a kind of symmetrical way right throughout the whole spinal kinetic chain. Now, this isn't a particularly good diagram in the sense that this is supposed to be showing a disc prolapse. Now, that would be the spinal cord. The spinal nerves are actually in this space here, but I couldn't find one that illustrated it well enough. But this is what people would term a slip disc. Now, technically, it's either a prolapse or a herniation. Now, as I said earlier, inside these discs are a jelly substance, and it can bulge and migrate a bit like a car tire with a bit of inner tube sticking out. Now, this type of problem causes a lot of pain as well, and very often it'll impinge on a nerve root. So you could end up with sciatica if you get this happening at the base of the spine, or if it happens in your neck, you'll end up with what's called a radiculopathy. You'll end up with arm pain and neuritis. Now, when these discs bulge, they also leak a very acidic chemical called cytokinin. So combination of the pressure and the chemicals released means it does create a lot of pain. And the good news is that 5% need surgery and 95% can recover. And one of the ways that you reduce this pressure is to have good level of mobility at each spinal level. So a stiff area in the joints will increase some of the disc pressure and potentially lead to further problems in the future. So moving on to who treats back pain. We've got, there are a lot of people doing manual therapy, and it's a bit confusing for patients because a chiropractor, an osteopath, etc. The common denominator in all of them is everyone uses their hands. Manual therapy. There is a lot of overlap. Physiotherapists can train in manipulation. Osteopaths like myself can train in things like electrotherapy and acupuncture. So there's a lot of people treating back pain manually. In terms of non-manual treatment, you've got GPs usually prescribing and referring. You've got orthopedic surgeons, which is, say, deal with the 5% that need surgery. You've got pain consultants. They specialize in things like injection procedures like epidurals and facet joint injections. And those are people who have not responded to anything else manually or medication. Then you've got rheumatologists who are basically looking at autoimmune conditions and diagnosing the causes of back pain. An interventional radiographer is someone who does MRI scans and x-rays, but also does actually inject as well. So they can double up with the orthopedic surgeons. And I didn't put neurosurgeons in there, but they're another group of people that also work, obviously, dealing with back pain. Neurosurgeons tend to deal more, as the name suggests, with nerve root related pain and brain injuries, brain problems. So when a patient goes to see a manual therapist, those of you who will have been to see physiotherapists, osteopath, chiropractors, etc., will know that the first part of the assessment is, apart from taking a detailed case history, the case history will ask you a lot of questions about the background to your pain, type of pain, whether you get night pain, etc. And then usually then followed by a clinical examination where you're assessing joint mobility and looking for areas of tenderness, stiffness, etc. If someone needs investigation, then then there are in the 1980s. I qualified in '83, and shortly after that, MRI scans started to appear on the scene, and they revolutionized the diagnostics. An MRI scan is essentially a patient goes in a tube in a very strong magnetic field, and then radio waves basically knock off water molecules, and then you get an image. So you see everything that contains water, which is pretty much everything. So on the MRI scan, which is the one on the left, you will see, if I can get the cursor to work. Yeah, here we go. So these are the discs, these blackened structures. The spinal cord is going through there. These are the spinal nerves running down. That's the front and that's the back. And you can see quite clearly here, this is an L4-5 disc prolapse. Now that looks bad, but actually you'll be amazed at how many people don't actually need anything drastic, even when it looks like that. They might recover with an epidural and then rehabilitation. And the X-ray on the right is what you would do in tandem with an MRI, particularly if you suspect someone might have a compression fracture or some sort of bony injury. So if you do get referred for investigation, it's usually going to be an X-ray and MRI as a starting point. You may have blood tests if they suspect some sort of inflammatory condition. The red flags, the most important one is if you get what's called cauda equina syndrome. So if you get a sudden onset of numbness around the anal and perineum area and you're unable to pass water or have bowel movements, then that really is an emergency. That means there's been a disc prolapse at the level below the sciatic nerve, what's called the S2 level. And it's quite rare, fortunately, but it is an urgent, something that you need to go in A&E and not even delay. So that's probably the most important one. And that has to be dealt with instantly. Obviously, if the red flags are if you're feeling unwell and you've got fever, if you're not improving with treatment or medication, you've got weight loss, poor appetite. And these are sort of questions, if you're seeing a manual therapist, they should be able to diagnostically sieve through this and decide whether you're really basically appropriate for manual therapy, or whether you need to be referred on for further investigation. And one of the things that in my clinic in Putney, our team are we try and follow everything through to the end. We in the sense, if we can't get rid of your pain, we will write to your GP, and whether you go down the NHS route or private route, we will follow everything through and try and find out what's the cause of your pain and try and get a resolution, as should every therapist. And essentially the aims of treatment are to reduce the pain and inflammation, restore the range of movement, and then the rehabilitation is really important, and I'll follow that, talk about that in just a moment. And that's basically building up the small muscles close to the spine, as well as the muscles over the top. And then probably the most important thing, if you're talking about trying to reduce back pain is educating patients, is making them aware of all the things they can do for themselves. There's a lot of fear and anxiety created by not really understanding what's gone wrong with your back. And part of the reason for this presentation is try and reassure you that if you follow all the things that I'm discussing, that actually you can do a big part in helping to reduce your incidence of pain. This is more about chronic pain. So if someone has pain that goes on for more than 6 to 8 weeks or even 12 weeks, then you start to get the nervous system becomes overly stimulated. You get what's called central sensitization, and then you start getting a lower pain threshold, and then you avoid activity, then you can't sleep, and then you start to get fear and anxiety and probably depressed and low mood because of your pain. And that kind of whole interaction between physical pain and then mental anguish just adds fuel to the fire, really. Fortunately, there are a lot of people specializing in chronic pain, and there are lots of methods of trying to get out of that cycle, one of which is actually trying to get fitter and stronger. So I'm not going to talk about that this evening, but on the psychological point of view, we have someone working at the clinic which helps with the stress management, and Fiona Worthington is great at helping people lower their stress levels and reduce their anxiety, which does help speed up their recovery and prevent further episodes. So the physical therapy essentially is working on different levels. I use acupuncture, deep massage, manipulation, mobilization, and I've got a little video to show what manipulation really means. As I said before, in the first stage, when someone is very acute, your objective is to get them out of pain using, I mean, if they're very acute, you're not going to start doing too much. You might use ultrasound and acupuncture and anti-inflammatories. Once they're out of pain, then you're working on the kind of stiffness and trying to get the range of movement back in all the spinal joint levels. Now, those of you who've never had manipulation before, I just wanted to, if I can get this video to work. There we go. So the purpose of what I'm doing here, go back to that. I knew I was going to have some technical problem. So yeah, so here I'm assessing how the spine is moving, and then I'm addressing this area of stiffness using what's called manipulation. That's slightly different from mobilization. This is using a little bit of gentle force to try and get the joint moving, and there should be a sort of popping sound and joint release. So that's in the lumbar spine, and here I'm checking the thoracic spine. I found a little area that's very stiff. I'm now using a technique to try and gently release that joint stiffness. Now, you can do manipulation or mobilization. Manipulation is sometimes a little bit quicker movement, and there I'm using it in the neck, because very often people have, as I say, 3 levels of pain, particularly if it's sort of office related. This is another technique to get the mid-back moving. So hopefully that didn't frighten you. It's actually quite gentle, and you would not do that without doing lots of massage and other things first. And also you'd educate the patient about why you're doing it and what the purpose of it is, because if you did that without doing that, people would be very surprised and probably put off. So manipulation is something that is actually very effective. I do talks, I've done talks of manipulation to teaching hospitals, to undergraduate doctors. And you would not do manipulation in certain instances. Obviously, if you suspect any underlying disc instability, if you have nerve root pain, which is really acute, if you have any suspected fractures or anything, you would only do this if you've gone through a kind of process of questioning to make sure this is appropriate. But it's an effective way of making sure that you're getting symmetry of movement. As I said, the important thing is in the spine is to have all of those levels moving equally and distributing force. So when it comes to rehabilitation, this is something that's probably really undercooked. My experience is that when patients have suffered pain and they're suffering pain, they're very compliant with exercises, and as the pain ebbs away, so does the enthusiasm for doing exercises. And I would say, probably without being too harsh, probably about 80% of people I treat, when I see them months later for a sort of checkup, they probably got a little bit slack on the exercise front. So the exercises are really important. And one of the reasons they're really important is when you suffer pain, and this applies to any joint in the body, the swelling and inflammation inhibits the muscles close to the joint. It's called arthrogenic muscle inhibition, but in plain English, it means that if you have pain and joint swelling, it will reduce your muscle tone and reduce your strength. So if you don't do the rehabilitation exercises, you will make yourself more vulnerable going forward. So a big part of beating back pain is making sure that if you have had back pain, you do the rehabilitation. And it's actually not something you just do for a few weeks. You need to try and think about doing this as part of your lifestyle. And I'll come on to that when I talk about my own story and why that's been very important to me and what a difference that's made. So when you start off recovering from back pain, you're really looking at trying to activate the muscles close to the spine. So these are what you call type 1 muscles. So these are muscles that need a lot of endurance. So when we stand up, we're fighting gravity. So these muscles need to be activated first. And there's a saying that basically says that you can't fire a cannon from a canoe. So if you remember that phrase, you can't fire a cannon from a canoe, you've got to get nice and strong around the spine. And there are a whole range of exercises. This one here is called the plank. You've got various types of sit-ups. You've got the bridge, and you've got the Superman. Now, you can do some of these fairly early on, even when you're in pain. Obviously, if you're in acute pain, but if your pain's subsiding a bit, if you're doing things like Supermans, you're not actually putting any strain on anything. And actually, if you start that early activation, that speeds up your recovery. So very important part of recovering and preventing back pain. So I also try and install the idea that these aren't just when you're recovering from back pain. This could be something if you go to the gym or you're doing exercise at home. You don't need equipment. So you don't have to do these every day. You can do this twice a week once you recover from back pain as part of your kind of prevention package. So I'm not going to, these are all videos. I'm not going to show each one because it will take a long time, but this is a bridge one. So
lie flat on your back with your knees bent. Squeeze your bottom muscles and lift your body upwards. Keep your arms by your side and use them to help you balance. Make sure you maintain good posture. Do not overarch your lower back. And contract the deep abdominal muscles by squeezing your tummy towards your spine.
Right, so that's an example of the exercise you can do fairly early on, but you can also do those going forward. They're all in, we use a video format. We've got various video formats. So instead of getting bits of paper, which A, uninspiring, and B, you can't really get the gist of what you're supposed to be doing, we try and use video base, which is, although it's it does help. I also think it's important to get a physiotherapist or an osteopath or a chiropractor showing you how to do the exercises, and then you do them on a video format, because it's quite hard to look at the video and then try and do them as well. So you ideally need someone to teach you, and then you can do those yourself. So I can't emphasize enough that how important it is to get that inner strength. And then these are other variations. You've got planks and lower abdominal and upper abdominal, different types of abdominals. There are a lot of core exercises. Anyone who's gone on YouTube or and had a look at the variety, it's a bit overwhelming. I always think it's better to do 4 really well than have a long list, because you're never going to do them if you've got a big long list to do. So I think it's important to keep it simple and try and do them really slowly and do them with quality rather than quantity. So what can you do to improve posture? Well, as I said before, posture is not, the old days, we used to think about Swiss finishing schools and deportment and so forth and being rigid. Well, we know from research that isn't how we should be. If you are slumping, you've got to change position. You just got to keep moving around. Don't try and stay in a fixed position. So, a lot of it is, there's a whole range of things you can try and do. Simple things like walking tall, when you're, something that's quite difficult to do in places like London with pavements, so you're not tripping over. But try and look in the horizon, try and elongate yourself instead of walking with your head down. Physical therapy, having checkups really helps, and having maintenance treatment rather than waiting till everything to break down. And manual therapy can be everything from massage to seeing your physiotherapist or osteopath. Sit-stand desks are getting a lot of attention, and it really only works if you do exactly that. You change position, you sit and stand. If you spend all day standing, that's quite challenging, cause back pain as well. So workplace ergonomics, obviously a big part of prevention. We're sitting more than ever before. I just read an interesting study about how people are now working. In the 50s, only about 50% of people used to do office work. Nowadays it's around 70 to 75, and we're sitting far more than we ever used to, and we're, and that's increasing around the world, and that seems to be a correlation with an increase in back pain. So prolonged sitting increases pressure on the spine. You get shortening of muscles, your hip flexors, your hamstrings, your gluteal muscles, because you're sitting all day long, can get weakened. So I think to stand up and change position regularly is a very important part of back pain prevention. And you can take these short breaks, 1 or 2 minutes every 30 minutes. You don't have to do, you can just stand up and you can do some exercises, roll your shoulders backwards and forwards, just do a little bit of movement. And then if you can do that and get into the habit of it, you can reduce your sitting time by about 40 minutes a day. So that was based on a Cochrane study of 2018. So regular short breaks is a really important part of the prevention. And sit-stand workstations reduce the amount of time significantly by 16%. It reduces neck and back pain, that's been shown in studies, and it improves your mood state, because actually you're also burning up more energy, which actually, if you look at the muscle activity, because you're standing fighting gravity, you're suddenly using all these core muscles just by the fact you're standing up. But as I say, you need to alternate, and that amount of time you spend standing and sitting will vary from person to person. You might just want to stand for half an hour. Some people can do it for an hour, but you need to keep changing. That increases your energy expenditure, which has all sorts of ramifications for your blood sugar level. It will you'll start burning up fat, and that's actually good for people who don't do any sport. You're using more energy effectively, which is a good thing. So as I said, stop and stretch, move around. We're designed for movement. We're not designed for fixed posture. So we can't get away from desks and computers, but we have to find ways of reducing the problems associated with them. So just get up and move around and correct your posture. And then managing your activity. This is all about pacing yourself. It's just a lot of people, for example, particularly with things like doing DIY, they'll go at it hammer and tong, literally. And the same with gardening. You know, as soon as the sun comes out in the spring, I see so many people have been in the garden for 6 hours and they hadn't done anything all winter. And I just say, well, you wouldn't go to the gym for 6 hours. So you just got to pace yourself. Just try and do it in bite-sized chunks. Just make sure you do a bit and rest, and then build it up slowly. And the same with, as I said, with gardening. That's a particular you know, problem. The other thing about things like gardening, you've got to think about body mechanics. About if you get in bad positions, the chances are you're going to injure something. So if you think about what you're doing, then that will make a big difference. You don't see powerlifters at the Olympics just nonchalantly wandering over and lifting up a huge deadlift, doing a deadlift. They spend ages getting in the right position. I'm not suggesting you know, if you're gardening, you spend ages getting the right position. Just be mindful about not reaching away from the body too much or twisting awkwardly. Just think about using your legs, feet apart. There are actually on our, before I forget, on our YouTube video, my wife and I in lockdown made a whole load of videos showing how to bend and lift, how to do ironing, how to do hoovering, unload the dishwasher, all the things I see patients getting injured doing. So that's all on our YouTube, on our website, www.putneyclinic.co.uk. And you'll look at you'll see our YouTube sign, and just click on that and you'll see videos that we produced, including Adrian Dilworth, who did a whole section for people with children, how to bend and lift children, because they're also another cause of back pain around the house, lifting and carrying them. I'm going to have to whiz through these. Nutrition and diet, well, there's a lot about supplements and so forth. I suggest, so you don't have really expensive urine, think about more about good quality foods rather than filling yourself with vitamins. There obviously it's important to have supplements. You can have supplements as well, but they shouldn't be a substitute for a well-balanced diet. We've got an excellent, very highly qualified nutritionist, Dr. Lena Patel, on our website. She works in remotely from Milan, where she's been doing her PhD in research. She's a mind of information. Again, you can, if you want to talk to her about nutrition, you can. All her details are on our website, and she'll help you, guide you on that side of things. Sleep is incredibly important. This is when our body repairs itself, and it's not until you get into a non-REM, non-rapid eye movement sleep, that the pituitary gland, a little gland in the front of the brain, releases growth hormone. Growth hormone is essential for repairing tissue damage. And one of the most important things is to make sure that you, from a prevention point of view, don't compromise on your sleep. Try and make sure that you're getting sleep. And if you are injured, you've really got to make sure you are getting as much sleep as you can. Obviously, there lies a problem, because if you're in pain and you're getting night pain, then that can affect it. But essentially, sleep is a very big part of preventing back pain and recovering. Massage. We've got two excellent massage therapists at the Putney Clinic, Toby and Dominica. This is a good part of your prevention, getting rid of those knots and tight areas and stopping your spine becoming stiff. Also, there's a lot of research showing that massage also benefits your immune system. So there's not just a physical effect; it also improves your general health, improves blood supply to the spine, and as I said, reduces tension and helps with movement and mobility. So being active doesn't just help the spine. We know that it reduces cancer, type 2 diabetes, heart disease, Alzheimer's, strokes. So there's a lot of research into keeping active, and being active doesn't necessarily mean going to the gym. It can be dog walking, it can be gardening, it can be doing housework. Just be active. Try and walk where you can. go upstairs instead of lifts and elevators. So try and keep active, and that is a big part of reducing back pain. Okay, very quickly, my story. When I worked in the 80s, I worked in Australia and New Zealand, and I also worked in Spain. But when I was in Australia, I was doing locum work in Australia, and I was in Sydney and between jobs, and I ended up doing a job on a construction site for a short period, which was great fun. I was outside, very physical work, beautiful weather, building 3 townhouses on the North Shore in a place called Manly. The new scaffolding went up. I walked on it carrying a load of bricks. The scaffolding collapsed and I fell 35 feet. I fell through what's called a stairwell into an underground car park. So I landed on reinforced concrete. And I'm probably here to be able to tell you the story because I hit my head and I landed unconscious. And the surgeon says that I landed like a bit like a sort of floppy rag doll, and that sort of helped some of the absorption of force. I definitely would have been killed had I not landed in that sort of state. I suffered compression fracture. This is actually my scan. Unfortunately, it doesn't quite show where the fracture was. The fracture was at T12, which is the lowest thoracic vertebra up here. But this one down here was also crush fractured, and you can see the discs here all pushing into the vertebra. So it's a bit of a mess, and I like to show patients this because it sort of makes them feel better about themselves. I suffered rib fractures, and I spent a long time in hospital. I did make a recovery over about a year, and I attribute my recovery to the fact I had fantastic treatment in Australia. They got me in a pool, they got me doing rehabilitation, I did Pilates type exercises. And the reason I'm able to work and carry on a normal life, and I do long distance cycling for charity, I swim, and I keep very active, is because I try and follow all the things I've just said earlier. I try and keep active. I keep doing my core exercises. Even though I did this in 1989, I still add my core exercises when I go to the gym, and I make sure I keep my routine. So, you know, just because you've suffered spinal injuries or you had a disc prolapse or acute back pain, it doesn't mean to say that you're going to suffer for life. I think you know, you can do a lot to help yourself, and the key is to do all the things that I've mentioned earlier. So in summary, back pain is common, affects about 80% of the population. That's 80% that go and see someone. So it's probably even higher than that. 95% of back pain doesn't need surgery. It resolves with treatment, physical therapy, medication, time. Only 5% requires surgery, even disc problems. The causes are multifactorial. I won't go through the list again. Prevention, posture, ergonomics, diet, lifestyle, a whole range of things. And I think the other thing is go and have an assessment every now and then. Don't wait till you go and see someone in acute pain. It's not unreasonable to go and see someone somewhere between 2 and 4 times a year. After all, you know, you take your car and you have your car serviced. You don't wait for things to break down and have to call the AA. So you know, it makes more sense to try and work on prevention. So try and go and see your therapist periodically, even when you're not feeling in too much pain, because actually you can do a lot to try and preempt problems. If you detect areas that start to stiffen up, you can work on them before you have a problem, rather than wait for it all to break down. As I said, regular massage and sleep and relaxation. So not just about exercise. The other big important thing, particularly in this crazy kind of fast world we live in, is the importance of switching off. So, you know, that is a really big part of trying to reduce stress and tension as well, is trying to learn to relax. And that's getting more difficult because we're bombarded by information. So try and take time out whenever you can. So that's my research assistant, my French bulldog Reggie, who wasn't a big contributor, as you can see, having a little nap there. So if you've got any questions, if you don't manage to pick my brains now, that's my email address. You can ask me some questions via email.